Yeah, so Evobrutinib is a part of a new class of drugs, that are oral tablets called Bruton's tyrosine kinase inhibitors. And basically, this is, the Bruton tyrosine kinase is an enzyme that plays a very important role in the immune system, particularly in B cells, so types of immune cells that we know is very integral to MS pathophysiology, or how MS develops and gets worse. So with a drug like Evobrutinib, the immune system, this Bruton kinase is inhibited, and that actually then has an effect on how B cells develop. And it's really has an effect then across the immune system to wipe out B cells, but also reduce the interaction with T cells, and also on the innate immune system potentially. So the use of Evobrutinib in relapsing MS, the results of this trial was recently published in the Lancet Neurology, and unfortunately did not show that it made any significant benefit when it was compared to a MS treatment called teriflunomide in reducing the yearly relapse rates in MS. And it also didn't make any difference compared to teriflunomide when the authors looked at MRI outcomes, like if people are developing new lesions and brain atrophy and so forth. So it was a bit disappointing from that point of view, but it is quite possible that this drug may have an effect in a different part of the immune system, in compartmentalized inflammation that we see more in progressive MS. And we saw some slight signals of that in the trials with Evobrutinib, with one of the MRI outcomes, which looked at smoldering inflammation in the brain, measured using an MRI technique called slowly expanding lesions. It did have some effect on that compared above teriflunomide, but it wasn't, seen on the disability outcomes in the trial, across all of them. So, it would really require some further study. And unfortunately, the drug company has decided not to study Evobrutinib further. However, there are many of these drugs that's currently in trials, and I think people may have seen some of the top-line results being released on Tolebrutinib, which is another one of these types of drugs that was quite encouraging for its effects that it was having in progressive MS in particular.